So hi, my name is William, and I'm going to be doing a physical assessment on a stuffed animal. The patient already performed the Snellen chart, and they received a 20/20, which means uncorrected, which means that the patient performed the assessment without glasses, and that they were able to read the 20 line perfectly, but were unable to read the line below. I was also able to assess the vital signs. The patient had a temperature of 98.6 degrees Fahrenheit. Their pulse was 66 beats per minute. Their respiration rate was 16 breaths per minute, and their blood pressure was 120/74 millimeters mercury on the left arm. Okay, so first things first, can I have you verify your name and date of birth? Okay, great. So, are you allergic to anything, to any medicine? Penicillin? Okay, great. What reaction does penicillin usually give to you? Okay. And are you allergic to anything else in the environment? Okay. How about, are you allergic to any foods? Okay. And where are you right now? What time of day is it? And who's the President of the United States? Okay. What is your mood today? Are you always happy? Okay. And what type, are you in any pain today? No? Okay, great. So I'm going to ask you some quick questions about your bowel movements, okay? How often, what's the consistency of your stool? Okay. How often do you have bowel movements? Okay. And now I'm going to ask you about your urine, okay? So what's the color of your urine? Okay. Do you ever have any burning, or is there ever any odor in your urine? No? Okay. And how often do you urinate? Okay, great. So now what I'm going to do is I'm going to start the assessment, okay? Okay, I'm going to hand sanitize. Okay. Okay. So first things first, I'm going to grab my pen light, and I'm going to check your ears. So your ears. Okay, so there's no drainage, no sign of drainage. There's minimum sediment, and it's a pink inside. So I'll check your other ear. Once again, there's no drainage. There's minimum sediment, and there's a pink inside. Okay, I'm gonna check your mouth next. Okay, can I have you open up? Okay, great. So your teeth are white. Your oral mucosa is red, which is good. Can I have you stick out your tongue and lift it up? Okay, great. So your frenulum is midline. And now can I have you just stick out your tongue? I'll check out your tonsils. Okay, great. Grade 1 tonsils. Next thing I'm going to do is I'm going to perform some eye tests, okay? So I'm going to do it twice on each side. First time for constriction, for direct constriction, and the second time for concentric, okay? Okay, great. Okay, now put that away. Okay, so next thing I'm going to do is I'm going to perform this 6 cardinal gaze, okay? So just follow my finger, don't move your head. Okay, great. The next thing I'm going to do is we're going to test for accommodation, okay? Just follow my finger. Okay, great. Okay, I'll put this down, hand sanitize again. And the next thing I'm going to do, is it okay if I touch you? Perfect. I'm gonna test for I'm gonna palpate your nose, okay? So start at preocular, and go to postocular, then go occipital, then go to pharyngeal, then go to submaxillary, and submental. Okay, great. Now I'm gonna check your cervical chain on your SCM muscle. Okay, on your other side, cervical chain on your SCM muscle. Okay, great. And then can I have you, I'm going to cut my fingers so I can check your supraclavicular, okay? Okay, great. Okay, great. And while I'm here, can I have you shrug your shoulders? Okay, great, symmetry. And I'm going to check out your arms, okay? So, just tell me if there's any pain when I do this, okay? Okay, so warm. Now I'm going to palpate for edema, okay? And your bony prominences. And I'm gonna check your cap refill real quick by pushing on the tip of your nail. Okay, less than 3 seconds, great. Less than 3 seconds, great. Now can I have you squeeze my hand as hard as you can? Okay, also strength is good on both sides. Now I'm gonna check if your skin is intact, okay? There's no lesions. No skin lesions, that's great. And color is tan, perfect. So the next thing I'm gonna do is I'm gonna check your reflexes, is that okay? Okay, perfect. So I'm just gonna go hand sanitize again. I'm gonna clean off the reflex hammer with some alcohol. Okay. Okay, so first things first, I'm gonna check your bicep, okay? Your bicep reflex. So I'm gonna put my hand on your antecubital. Use the short side. Okay, flexion, great. And your other one, antecubital. Okay, great, flexion. Now I'm gonna check your tricep, okay? Okay. Okay, oh, extension, great. Extension, great. Okay, next thing I'm gonna check is your brachioradialis. So can I have you bend your arm? I'm gonna go 2-3 inches above your wrist. Use the back side. Okay, supination, great. I'm gonna check this side now. 2-3 inches, great, supination, okay. So before I do your, check your knees, before I touch your knees and for your reflex, I wanna ask you, have you ever had any surgeries, prior surgeries or injuries I need to know about? No? Okay, great. So then can I have you dangle your feet? Okay, great. So then I'm just gonna check it real quick. Okay, extension, great. Okay, extension, great. Okay, thank you. So next thing I'm gonna do is I'm gonna listen to your sounds, okay? Okay, I'm just gonna sanitize again. I'm gonna make sure I clean my stethoscope. Go to you. Okay. Okay. So I'm actually gonna listen to your carotid arteries first, okay? So I'm gonna flip it to my bruit side first. Can I have you take a deep, hold your breath, please? Okay, great. Take a breath. I'll listen on this side. Hold your breath. Okay, great. There's no bruise. Okay, next thing I'm gonna do is I'm gonna palpate, okay? Okay, great. Okay, great. So now, what I'm gonna do is listen to your heart sounds. Is that okay? So I'm gonna flip back to the diaphragm with my stethoscope. And I'm gonna listen to your aortic. Okay, so S2 is louder than S1. I'm gonna listen to your pulmonic, which your S2 is louder than your S1, which is very good. Now I'm going to go to your Erb's point, okay? Okay, so S2 is equal to S1. Now you go to your tricuspid. Okay, so your S1 is greater than your S2. Now I'm going to your mitral, which is in your 5th and 6th intercostal space. Okay, and S1 is greater than S2. Okay, great. So now what I'm going to do is I'm going to continue listening to your lung sound. So every time I put my stethoscope on you, can you take a deep breath for me, please? Okay, thank you. Okay, great. So can I actually have you turn over so I can check your backside, please? Okay, great. Thank you. Okay. And again, when I put my stethoscope on you, can you take a deep breath for me? Okay, great. And while I'm here, I'm going to listen to your respiratory expansion, okay? Put that down. Gonna sanitize real quick. Okay, great. I'm going to go down to your T10. Can I have you take a deep breath for me? Okay, great. Thank you. Okay, so next thing I'm going to do is do your abdomen, okay? So I'm going to have you lay down for me. Great. And lift up your shirt a little bit. Thank you. I'm going to hand sanitize again. So what I'm going to do is I'm going to go down to eye level. I'm going to check, make sure the umbilicus is centered. Okay. I don't see any palpitations. Okay, and then I'm looking for lesions. No lesions. I don't see any lesions or masses. So that's great. So next thing I'm gonna do is I'm gonna get my stethoscope so I can listen. Okay, I'm gonna clean that off again real quick. Sanitize again. Great. Okay, so make sure it's on my diaphragm side. I'm gonna start at your right lower quadrant, okay? Okay. 15 seconds. 15 seconds, right upper quadrant. Left upper quadrant, 15 seconds. Left lower quadrant, 15 seconds. Okay, great. I heard about 16 gurgles per minute, which is great. Next thing I'm gonna do is I'm gonna check your perbruis. So I'm gonna flip over to my diaphragm again on your left mid clavicular line. Okay, great, no bruise. Okay, so next thing I'm gonna do, I'm gonna put this back. I can hand sanitize again. I'm gonna palpate, okay? Or percuss, I'm sorry. So, okay, tympani, good. Next thing I'm gonna do, tell me if you're in any pain when I do this, okay? I'm just gonna palpate lightly. Okay. No pain? Great. Okay, so what I'm gonna do next, because you're already in this position, you can pull back down your shirt. I'm just gonna check your feet, okay? Okay, I'm gonna check your popliteal pulses. Make sure they're symmetrical. Great. Now I'm gonna check your dorsalis pedis pulses, make sure they're symmetrical. Okay, great. Next thing, can I have you push on my feet? Great, can I have you pull? Okay, great. I'm gonna check your cap refill, okay? Is that fine? Okay, less than 3 seconds, both good. Okay, now I'm gonna make sure that your skin is intact, is that fine? Okay, paws look good. Same color as the rest of the body, tan. That is great. Can I have you lift up your feet real quick? Move your knees in. Okay, you can do that. No pain? Great. Okay. So the next thing I'm gonna have you do for me is you can stand back up. Okay. Stand back up. Okay. So can I have you follow me? Go do what I do. Okay, great. And then can I have you lift your right leg up? Pull it up on your left leg. Did great. Now can I have you do your left leg up? Your right leg? Perfect. Okay. So now I'm actually gonna have you stand up because I want to do some cranial nerve. Actually, you know what? You can sit down. I'm sorry. We're gonna do some cranial nerve tests. Okay. Can I have you smile for me? Okay. Perfect. Can I have you stick out your tongue? Great. Now can I have you stick your tongue left and then right? Great. 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 Okay. So now we're gonna do some tests. Okay. I'm just gonna quickly sanitize. Okay. Can I have you walk 5 feet for me? Great. I see your gait. Okay. Now when you walk back, can I have you put one leg in front of the other? Great. Okay. So next thing I want to do for you is I want to do the Romberg test. Okay. So I'm going to test your balance. So what I need you to do is to put both hands on your side, both feet together, and close your eyes. I will have my hand in front of you and behind you, just in case. But I need you to do it for about 20 seconds. Okay. Great. Okay. So the next thing I want you to do is we're going to do the smell test. Okay. So things are sanitized, but I'll sanitize it. Okay, so first thing, I want you to close your eyes and cover one nostril, okay? Can you tell me what that is? Great, okay. Now can you cover the other nostril? Keep your eyes closed. Great, okay. Thank you for telling me what that is. Okay, and the last thing I want to do is do the whisper test. Is that okay? Okay, great. So just cover one ear, close your eyes. Could be right ear. Okay, great. Now cover your other ear. Okay, great. Okay. Well, that sums up your assessment. Thank you so much. I'm just going to quickly hand sanitize. And thank you for allowing me to do an assessment on you today.